For the initial conditions, the patient's posture is upright with forward head looking up and rounded shoulders. The patient is cognitively aware and able to respond to the environment, is in a stable emotional state, understands the task, and is not disoriented. The patient is in a spacious kitchen, there are no loud noises, and appears to be in the presence of one other person, the person filming her. The patient does not appear to have any obstacles on the counter or the floor. In terms of preparation, the patient does not appear to be receiving any cueing during the task and has a quick reaction time. The patient understands that she is doing an overhead reach and has previous experience doing so. The patient has the cabinet door pre-opened and positioned herself closer to the counter and is facing the open cabinet. For initiation, the patient starts fairly quickly. The direction is anterior and superior, slightly lateral. Head and neck are extended back. Eyes are looking up at the cups. Upper trunk is upright with no rib flaring. Lower trunk is neutral. The shoulders are rounded and the hands are resting on the counter. The feet are planted on the ground. The movement is smooth with no delays. For execution, the direction is anterior and superior and slightly lateral at first, and then redirected back to anterior and superior. The speed starts out fast, but then slows down when regaining balance by leaning with left hand on the shelf. The movement starts out smooth, but then becomes choppier. When reaching, the patient is smooth and fairly quick, but once the patient reaches the shelf, instead of grasping and lifting the object, the patient regains stability by leaning laterally on the shelf with her hand, and then redirecting that hand back towards the object for the grasp and lift once stability is regained. For the reach, the patient is looking up with head and neck slightly extended. The upper trunk is rotating to the opposite side, the right side, with a slight right lateral flexion. The patient is leaning the pelvis onto the counter for balance with slight lateral flexion to the right. The upper trap creates a shoulder shrug on the left. There's left shoulder flexion. Elbow is softly extended with a neutral wrist. The upper extremity follows the anterior superior direction. Right upper extremity is still placed on top of the counter for balance. Both of the patient's knees are bent, and it appears that there is a slight heel raise as the patient gets closer to the shelf. The patient at first grasps the shelf itself to regain stability, which is lateral to the cups. Patient first uses a pinch grip to grab onto the bag of cups and crawls her fingers up superiorly until she has more of a firm or cylindrical power grip on the cups. The patient's lifting force slowly overcomes the weight of the cups, but not fully to where she can lift all of them up superiorly. The patient begins to use gravity, her descent from her heel raises, depression of the shoulder, extension of the shoulder, elbow flexion, and wrist extension to drag the cups down inferiorly. The patient then uses the right upper extremity to reinforce the lift on the other side of the cups with a cylindrical power grip. For termination, the end of the lift goes quickly with the descent towards the posterior inferior direction. For stability, the patient is no longer leaning on the counter and uses her flexed knees and feet for stabilization. The patient has better stability now without the leaning and heel raises. The movement is smooth as the patient uses both hands to reinforce her hold, lift, and retrieval of the cups. The patient continues to look up at the shelf and keeps her head and neck extended. Her shoulders are rounded and her upper trunk is neutral. The lower trunk is no longer leaning on the counter, and the patient is in a slight posterior pelvic tilt. Both upper extremities are used to hold the cups. Shoulders are slightly hyperextended, elbows are flexed, right wrist is neutral, left wrist slightly extended, and right hand more superior to the left hand. The feet are planted on the ground, and the patient has fully descended from her heel raises. The knees remain slightly flexed. For the outcome, the goal was to do an overhead reach, and the patient was able to do it on her own with no tactile or verbal cues from her therapist. The patient has limited range of motion in her shoulder, neck, and knees. The patient appears to be cueing herself verbally in a quiet tone.